Well, hello, welcome to HealthLine on this Tuesday evening. I'm Jennifer Blomquist. I'm so glad you're joining us. No matter if you've watched this show a million times, because it's different every time we're a live program, or if you're new to the show, I guarantee you will learn something tonight, get some free advice. We actually have a physician assistant who is with us tonight. She's been with us many times before. She specializes in orthopedics, and we're going to be talking about something I think a lot of us maybe needs to be educated about, orthopedic walk-in clinics, like when to go to them, or maybe when to go to a regular walk-in clinic or the emergency room. So you're going to learn all about that tonight, and please feel free to give us a call at any time once we get our conversation started. And that's why we keep the phone number up at the bottom of the screen. It's up there throughout the show so that you can call in any time and ask our guest a question. So it's 969-2720. If you're outside of Fort Wayne, put an 866 in front of there, and that'll get you through toll free. And so we'll go ahead and introduce you to our guest. But again, I always tell people to call sooner rather than later because sometimes the phone lines get pretty busy toward the end of the show. So feel free to interrupt us at any time. Our guest tonight, I hope it's a familiar face if you're a longtime viewer. This is Jodi Chambers, also a friend of mine. She's the physician assistant specializing in orthopedic care. Mm-hmm. So
thanks for having me back.
Oh, thank you so much. Well, I think I was excited about this topic because I've been going to orthopedic walk-in clinics a lot with my children the last couple of years, a lot of baseball and softball type of injuries. And I like it, because they have, it seems like to me, you can get everything done there quickly, and it's what they specialize in. So I personally thought we've had a positive experience with it as opposed to going to just a traditional walk-in facility. They may not have X-ray, MRI,
Correct.
Some of the things you need. So in general, if you have an injury, how do you decide what makes more sense?
I think the biggest distinguishing factor between regular walk-in clinics and orthopedics ones, we're not going to deal with the colds and the flu. So, if it's something that you don't feel like you should be exposed to other people because you're not sick, then maybe, so neck pain, back pain are our two most common. Fractures with kids. Yeah. Most clinics can do some small suturing, but not like big things.
Okay.
A general rule of thumb is if it's crooked, probably not for a walk-in clinic situation because we probably don't have the appropriate medication to make you comfortable to set that fracture if that's indicated. But for the most part, fractures, back pain, I would say is a big one. Yeah. Neck pain, shoulder injuries, tendinitises. This summer we saw a lot of people with hamstring pulls, Achilles tendon ruptures. So I would say if you're like, I don't know if it's my, if it's an extremity, then I would say a walk-in clinic is the appropriate place to go.
So if you decide to go in, I'm just wondering, sometimes it can take forever to get an appointment to get in to see an orthopedic specialist because it's such a busy specialty. So say it's not an acute thing, you didn't like injure something, but maybe over the last few months, like you said, your back has been hurting. Is that okay to go to an orthopedic walk-in clinic if it's not like urgent, it's just something that's creeped up but you can't get in to see the doctor?
I would say for the most part, yes. Okay. So there's some, most orthopedic walk-in clinics here in Fort Wayne are all ran by probably physician assistants and nurse practitioners. Yeah. I would venture to guess that you probably would not see a physician in those situations, but and rightly so, I don't think that it's appropriate or needed. If we have any issues, we can get a hold of any of those people. So chronic things, yes. The things that aren't appropriate for walk-in clinics are second and third opinions. We've had people that have come in and say, I've had 3 back surgeries and I'm here to discuss my MRI from a year ago. Okay. That warrants an appointment. But, if you said, hey, I had back surgery a year ago, but I lifted awkwardly and now I'm having acute back pain, absolutely.
Okay.
Some people come in because they think that they can get a stat MRI. Very infrequently are we going to order a stat MRI. If we're to that point, we're going to send you to the ER because we're that concerned. But it's not a loophole or a get around to get an MRI that day. We can order MRIs if it's clinically appropriate, but
they wouldn't normally just do it right then and there. Okay.
Nope. I would say since 2017, I have not ordered a stat MRI in the clinic unless I sent you to the emergency room.
So X-rays, though, that seems to be pretty common. Yeah, they would all pretty much have X-rays.
I have not worked at every orthopedic walk-in clinic, but I've worked at several, and I would say that all of them have X-ray on site. Some walk-in clinics don't have non-orthopedic ones don't have x-ray, or maybe they only have x-ray till 4 or 4:30, but they don't have x-rays past till 8 when they're open.
Yeah.
So, we get a lot of people who unfortunately went to another walk-in clinic and they were sat for 2 or 3 hours because they're there with all the sick people.
Yeah.
And then they come in to see us because they found out they didn't have x-ray.
Yeah.
So, I guess the deciding factor for me would be, am I ill or am I hurt?
Yeah.
If you're ill, we're not your go-to spot.
It is nice that most of them are open till 7 or 8 at night.
Yeah, I would
is,
say most are 7 to 7 or 8 to 8. And I think that it is appropriate for both ends because the 7 to 7 catches the kids at like Fort Wayne Community Schools who don't have to come to school till later, so they can get in and out in the morning. We see a lot of kids at the back end of the day because they were at practice and they got hurt. So, ideally the people who, got home from school, like right now it's going to be the kids got home from school, they were playing out in the yard and they fell off their swing set.
Yeah.
Those are the things we need to see because that doesn't need to go to the emergency room unless it's crooked. If it's obviously deformed, we could see it and splint it, but we're probably not going to be able to do definitive care.
So that would warrant an emergency room visit.
Yeah, if it's obviously deformed.
Okay. All right. Good information. We're going to talk more about walk-in clinics, but we did, Jodi, get a call from somebody who wanted me to ask for him. So this is from Marshall, and he wanted to know, can walk-in orthopedics treat something like arthritis?
Oh, absolutely.
That's a good question.
So let's say you have established care with a surgeon and you just need an injection. So we get a lot of people who are like, I'm getting ready to go on vacation, or my grandkid's getting married and I need to be able to be available at the reception.
Yeah.
So we can do those. There are different types of injections that may not be done. So some people use the lubricant injections called viscosupplementation. That has to be pre-authorized with insurance. So that would not be one you could get by walk-in. We could order it and it could get set up, but for cortisone injections, we can diagnose your arthritis if you didn't know you had it. We can talk about a treatment plan. We can start you on a medication regimen. So physical therapy orders, all of that stuff. So absolutely, that's probably 50% of what I do a day.
And you kind of mentioned some things that needed to be approved by insurance. Do you find that most people don't have, is there any insurance barrier that people run into in terms of going to an emergency room versus a walk-in clinic?
Yes, there could be. It depends on the individual clinic. So some clinics will require a cash upfront fee.
Yeah.
If it's an emergency room, because they're all federally funded, they can't turn people away. So if finances are an issue, then there may be times. It's not very frequent. I would say 1 to 2 times a week do we turn people away. It's not very often. Or if they've gotten referred, they've been to the emergency room, they were diagnosed with a fracture, and then they're told to follow up, they're not going to incur that because they've been referred from the hospital.
I see.
So.
Yeah, this is all outpatient, obviously.
Correct.
The walk-in clinics, you're not going to be admitted or anything like that.
No, if you would be admitted, it would be through an emergency room. We don't have any direct admit situations as of yet. It may happen, but not right now.
And I wondered, is there any cost difference? Like, would your insurance like it? Because maybe it's
for sure
cheaper than going to,
So, and a lot of that's dependent upon insurances, but it's definitely going to be a smaller out-of-pocket expense because most of them are treated like just a regular office visit.
Oh, okay.
So, and that a lot of times depends on how the clinic would bill it, but I would say for a majority of it, it's just an office visit appointment.
That is always much cheaper than what you have to pay to go to the emergency room.
In time. I would say, Mondays, no matter where I've worked, Mondays are always awful. So I always tell people, if it's been going on for like 3 months, don't come on Monday because you're going to end up waiting. But most of the clinics I've worked at were staffed with 2 people on Mondays because to accept the influx of patients over the weekend. But I would say most of the time it's not more than a couple-hour wait, and we try and get people seen as efficiently as possible without compromising any quality of care, obviously.
No, the emergency room can be a long wait,
Yeah.
and especially if you have a child, then
Yeah.
it's really difficult. We did get someone else who wanted me to ask a question for you. So they wanted to know if you treat arthritis for knees. This is going back to Marshall. I didn't see the whole question. So
okay.
Marshall, thanks for calling in, Marshall. But so he was asking about if you could treat arthritis, but what he wanted to also know what you would prescribe for something like that.
So typical arthritis workup would be ordering x-rays, talking about what other medications you are, because obviously there's interactions, so that not every person is going to have the same prescription. We'll probably talk about weight reduction, because for every extra pound, it's an extra 4 pounds that are being distributed through your knee. So does weight cause arthritis? No. Does it exacerbate it? Yes. So we may have that discussion. If it's a issue where you're not strong, then we may talk about some physical therapy exercises.
Yeah.
The x-rays are going to be done to discuss what the status or structural status of your joint is, whether it's a knee or a shoulder or whatever. But so we would do that, and then we would come up with a plan. So commonly it would be medication, whether that's over the counter, whether that's prescription, maybe it's an injection, maybe it's physical therapy, maybe it's a combination thereof. Maybe I'm suspicious that it's something that I need to get an MRI, and I can start that process in motion. We can get things started and then get you into a surgeon. So the other nice part about the walk-in clinic is it saves the appointments for the people who need to see a surgeon. So once you get there, you're talking about a surgical problem. Or maybe it's a hip problem, and maybe you see a hip doctor. Well, it wasn't your hip; it was your back. So the other nice thing about walk-in clinics is we do general orthopedics, so we can step back from a bigger, broader perspective and say, okay, yeah, you say it's your hip, but I really think it's coming from your back, so we can streamline you to where you need to be.
All right. Yeah, and I guess another question somebody had was about, are you going to know necessarily if you're going to an orthopedic walk-in clinic? I mean, are they identified as that, or some of them
That's
are just
a good question.
Might be associated with a healthcare system in your community. But do you have to? I mean, I don't know if it would identify it outside.
Yes, I would say that almost every
it?
clinic probably has some version of ortho in its.
It would say ortho. If it doesn't say ortho like in their title,
Correct.
then it's probably just a
Correct.
regular walk-in clinic.
And everyone has access to everything on their phone, so
Right.
you can type in ortho clinic near me,
Yeah.
and you're going to get the closest ones to you, and then by that point it's like which is more cost effective for you through insurance.
Yeah.
So.
No. And and I've had that personally, that experience before, where I went to a place, and I don't know if the person I talked to was new or didn't know, but I had a bulging disc in my back. I didn't know it. I just couldn't walk. So I literally crawled into this clinic, and of course everyone's staring at me, wondering why she's not walking. And anyway, then after waiting for an hour, just laying on the floor, they're like, "Oh, we don't have an X-ray machine here." So you'd be amazed. It can happen. They get busy, and then they're like, "Oh yeah, we should probably tell that lady that she has to go somewhere else." So you would think that you wouldn't have to ask, but I guess it probably makes sense.
Yeah,
they're busy.
Yeah, and that would probably not be something that the front desk would probably volunteer to you.
Yeah,
because
sure.
it could be that it's coming from your appendix.
Something
so
else, yeah.
That would be probably a proactive question for the patient to ask. Is I'm here for what I think is an orthopedic problem. Do you guys have X-ray in-house? And that may make the decision for you.
Yeah, no, it is, and that is a lifesaver to sometimes be able to do one-stop shopping.
Yeah.
So, so we have somebody named Buck on the line, and he is going to ask the question himself. So, Buck, are you still there?
Yes, I am, ma'am.
Thanks for your patience. You want to ask Jodi your question?
Hi, ladies. I was wondering, I had a injury playing a sport today, and if I ice it, how down the road effective is that? Meaning 3 months from now, the amount of ice I do with it today, does that have a significant difference on? And I'm older, 50 or above. Will that have a significant difference on the lasting of the injury? And then it's tonight and night where I, rather than focus on sleep, is there a certain amount of icing I should be doing every other hour? And and I'll just hang up and just kind of leave it at that. But
Okay.
give me some pointers on the icing type stuff, would you? Thanks a lot,
Yeah.
ma'am.
That is an excellent question, Buck. So a couple of things. Ice we typically use for the first 24, 48, 72 hours because you think of it as you got injured and you have this flame in your body and you're trying to calm down the flame.
Yeah.
If you put heat on that acute injury, it's like putting gas on a fire. You're making the flame bigger. So ice is never the wrong answer, but heat usually is the first 72 hours of an injury. So I always tell patients, you know, ice is never wrong. Heat is going to be wrong at the front end. But let's say, like he mentioned, it's 6 months down the road. Well, why is it sore? Is it sore because you exercised it, it's inflamed? Or is it sore because it's stiff because you haven't been doing anything? So sometimes I tell patients, you know, it may be different every day. You know, today heat may make it feel better, or tomorrow ice might make it feel better. But general rule of thumb is about 20 minutes, 2 to 3 times a day if you can get it in, but 1 to 2 is fine. And don't wake up at 3 a.m. because it's, you know, time for icing. That's, you know, sleep is much more important for the healing process than ice at that point. Basically, icing is just another way that we treat symptoms and treat inflammation.
Yeah.
So.
I hate icing because it's so cold. I know I've heard that about the heat. Like, what about for your back though? I mean, I always feel like
depends. Like, so if heat does feel better, if it's something that you're like, well, I know I'm going to play softball tonight, so I'm going to put some heat on, or to put on my car seat heaters on my way to the game.
Yeah, that's true.
But then if at the end of the game it's sore, then I would say follow up with ice. Yeah.
What about, people have been asking about arthritis, we're talking about the back. Like, I do see creams, topicals that are supposed to be pain reducing or kind of numb it, I guess.
I think there's a lot of good options. I think there's so many, and so there's prescription kinds and then there's supplemental kinds. So the difference is prescriptions have to go through FDA standardization. Supplements don't. So when you get into the supplements, I think it can give people a bad taste in their mouth because you're not comparing apples to apples and oranges to oranges. So prescriptions are more consistent, but there are supplements that are prescription medications that would be helpful as well, but you just don't know because everything's different. So they, you know, they could say, oh, it can turn my hair blue, but you would quickly figure out that that's not going to happen. So, but I think topicals are extremely beneficial, especially for like tendinitis, like of your wrist, of your elbow, because those are very superficial tendons to the skin. So it's going to absorb. If it's a hip problem, probably not, just because, you know, that's a pretty deep tissue area. But sometimes like arnica, which is an anti-inflammatory cream that helps with bruising. Sometimes we'll prescribe that post-operatively because it can help with inflammation but not cause any bleeding side effects. So I mean, there's a lot of things that go into those decision making of what we decided to use.
Yeah, for every good benefit, there's always a side effect, so you have to keep that in mind.
You have to balance the pros and cons for sure.
Let's see, we have somebody who wanted me to ask the question for him. So Leslie wants to know if a walk-in clinic can treat more than one broken bone injury.
So it would depend. Let's say you tripped on the stairs and you broke your toe and you broke your wrist. Absolutely. Now, if you broke your femur and you broke your humerus, 2 big bones, I don't know that would be something that would be appropriate in a walk-in clinic. Sometimes there is time constraints that may say that we can only see 2 body parts, because, you know, there's sometimes people come in like, oh, I have head to toe pain and I want to get all of it evaluated. That's just not a feasible request, nor could we do justice to treat all of those different injuries. So yeah, I would say probably 2 body parts, but it's going to depend on what body parts, or maybe it's your finger and your wrist, or, you know, your ankle and your thumb or something like that. So
that's a good question.
That's a really good question.
Yeah, because I just wanted to emphasize, you guys don't do surgical procedures.
No, we do not do any surgical procedures.
Nope.
Nor can we get you like scheduled that same day. If that's the situation, then we're probably sending you to the ER and getting things done that way. That would be very, very infrequently. Some people think that it's a backdoor approach to getting to what you need to get done, but we still have to go through the same hoops. We're just more of more instant access.
Sure.
And so, but I think the best part of what we do is that we approach it from a general orthopedic standpoint and then triage you down to where you need to be. So once you're with the physician, you're with the appropriate surgeon or the physician or the team that you need to be with.
Yeah. All right. This is a good question too. You kind of mentioned this, you know, that you're probably going to see a physician assistant, a PA, or a nurse practitioner, NP. And somebody was calling to say, what is the difference between a PA, a nurse practitioner, and an actual physician?
Really good question,
All
Martha.
three can prescribe, right?
Correct.
Okay.
Correct.
They can all
So
prescribe.
physicians, obviously, you can have, you know, MDs, but they're not surgeons. So obviously, once you get to the surgeon level, which almost everybody that I work with are surgeons, have had fellowships and residencies. Physician assistants are trained in the physician model. So they have to get accepted into physician assistant school. We're trained in like a 4-year medical degree, condensed into a 2-year degree, but you have to have a lot of experience to even get accepted into the school. So it's not like you're taking somebody out of high school and they're getting straight into PA school.
It has 4 years of undergrad.
Correct.
And then the PA.
And then nurse practitioner is the master's degree level for nurses. So they're in the nursing model. So it's just functionally, when you meet us, we're going to what a nurse practitioner does at my job is the same thing I do.
Okay.
Nurse practitioners tend to do more like family medicine, OBGYN, things like that, but they can be surgeons, they can be all, you know, work in any specialty just as PAs can. So it just kind of depends on what the individual clinician is comfortable with.
Yeah. That is a good question because you don't see a lot of, gosh, I don't remember the last time we saw a physician at any kind of a walk-in clinic, but we still had really great care, you know, and very knowledgeable.
Yeah, I think I call us like the octopus arm. So when I first started 25 years ago, the physician can only have 1 PA that they supervise. Now you can have up to 5 in some states, some up to 8. So one physician can give themselves 8 arms so that they can be able to, you know, capture all those patients and then dissect down what they feel like you need, you know. So once you get to the surgeon, you're going to have more time with them because they're not seeing things that aren't appropriate for them to see.
Right. Well, I was going to say it probably as a patient saves you time because, you know, if there are 5 PAs that can help versus just 1 doctor, you'd be waiting a lot longer.
Yeah.
So. Let's see, we are getting another call coming in. We have a lot of shy folks tonight. They're asking me to ask the question for them. So a woman named Pam wanted to know, what is sciatica and what would be the treatment for that?
So sciatica is the nerve that runs down from your back, usually at the L5S1 level, and it runs down your back, down the posterior buttock into the back of your leg. So some people call my back pain my sciatic pain. Sciatic pain is a very specific nerve that gets irritated, but we tend to casually throw it out as, oh, my sciatic nerve is inflamed. And so sciatic pain typically causes pain down the back of the leg. It can cause burning, it can cause weakness, it can cause spasms, because once the nerve gets irritated, then it causes muscle spasms. So if a nerve is annoyed, it kind of does this like, hey, what are you doing? What are you doing? And then the muscle gets mad, and then you get the muscle spasms, and then it becomes this cascade. So just like anything else, it's an inflammatory problem. Treating the symptoms, getting your inflammation calmed down, whether that's with the prescription, steroids, non-steroidals, giving them a muscle relaxer if that's appropriate. There's nerve pain medicine we can use. And then every person that has back pain thinks that they need an MRI. And I would say 80% of adults are going to get back pain in their lifetime. 80%. So of that 80%, I would say maybe 20% of those people would be surgical candidates. So what we do is we start everybody the same, and then if after 4 weeks of therapy or medication, we're starting to notice that they're not responding, then we'll start doing the MRIs and the CT scans and whatever test is next in line to be appropriate. But most of the time it's medication, physical therapy, work restrictions, modifications of activities, and then keeping an eye on symptoms. The things that make us nervous is if you're starting to get weakness, then we have to pay attention. I always describe a nerve as like a hose, and the longer the hose is kinked, the less stream is going down. So the stream going down is going to be either function or pain. So if you have pain but you don't have weakness, not that I'm not concerned about that, but I know that that's not a permanent issue. But when you maybe have weakness but not that much pain, that's much more clinically significant. So that's what we're looking at. And if that's the situation, then I'll be like, you know what, we need to probably get this now instead of later.
Yeah.
So I think that people think we have these algorithms of treatment plans, and absolutely isn't the case when we're dealing with, because it's every patient's different. So
I was going to say, yeah, especially with orthopedics, it seems like, and I see some people of all different ages too. I mean, I see they're very young.
Yep.
Usually those are injuries that I can tell, but you know, but then you see other people that could be just wear and tear.
Yeah.
Or,
Some days I'll have 6 people that are over 90.
Yeah.
Some of them are arthritic. Some of them have a fracture. I mean, it's crazy how functional some people can be. And so my takeaway every day is, just being kind to your body and not taking for granted your ability to function and to move. And, our bodies are made to move, and sitting is the new smoking. And so people we're seeing so many people that are having deconditioning problems because we're not active.
Right.
So, but those people that are in their 90s, they're going after it. They're playing pickleball and walking. And
we should all aspire to be that way.
Yes.
Well, this is, of course, Jodi Chambers. Thank you so much for coming on. Unfortunately, it does go so fast. And thank you to everybody who called in. They had great questions. And you'll have to come back again soon.
I will.
So we need to catch up, gossip and things.
Yeah.
So thanks again for joining us. And there's another HealthLine next week, the same time, same channel. I'm Jennifer Blomquist. Take care. Have a great rest of your week. Bye-bye.
The preceding program on PBS Fort Wayne was made possible in part by
momentum, progress, innovation. Parkview Health knows standing still isn't an option. We must learn, grow, excel, and actively work to advance healthcare for our community and beyond. With technologies that improve access to care and teams of specialized providers, we are moving healthcare forward. Right here at Parkview Health.